Nobody plans to end up in a nursing home. Ask anyone over 65 where they want to spend their final years, and the answer is nearly universal: at home, in familiar rooms, surrounded by their own belongings, their own memories, their own dignity. Yet every year, over 1 million Americans are admitted to nursing facilities. Most of them believed it would never happen to them. Most of them were wrong, not because of bad luck, but because they ignored warning signs that were visible years before the crisis that made the decision for them. Here is the uncomfortable truth your family will not tell you, and your doctor does not have time to explain. Nursing home placement is rarely a sudden event. It is the final chapter of a story that began writing itself 5, sometimes 10 years earlier. And the early chapters have specific, identifiable features. By the end of this video, you will know the 5 warning signs that most reliably predict loss of independence. More importantly, you will know exactly what to do if you recognize any of them in yourself, because recognition without action is just informed helplessness. Most people our age avoid this topic entirely. They consider it morbid, pessimistic, defeatist. Since you are watching this, I suspect you understand something they do not. The only way to avoid a destination is to recognize when you are heading toward it. Let us begin with the sign that surprises people most, because it has nothing to do with physical health. The first predictor is social isolation, not loneliness in the emotional sense, though that matters too. I am talking about the measurable reduction in meaningful human contact. Fewer conversations, fewer visitors, fewer reasons to leave your home and interact with others. Research from the National Institute on Aging has repeatedly demonstrated that socially isolated seniors are significantly more likely to require institutional care than their socially connected peers, independent of physical health status. The effect is so pronounced that some researchers consider isolation a stronger predictor than chronic disease. Why would this be? Because human beings are not designed to function alone. When you are isolated, there is no one to notice early warning signs. The slight confusion that might prompt a concerned friend to suggest a doctor's visit goes unobserved. The subtle decline in self-care that a regular visitor would notice happens invisibly. Small problems that could be addressed early become large problems that require institutional intervention. But there is a deeper mechanism. Isolation accelerates cognitive decline directly. Your brain requires social stimulation, the complexity of conversation, the challenge of navigating relationships, the mental exercise of considering other perspectives. Without this stimulation, neural pathways weaken. The very organ that maintains your independence begins to atrophy from disuse. I watch for this in myself, constantly. When I notice a week has passed without meaningful conversation beyond superficial transactions, I treat it as an emergency. I call a friend. I attend something, anything, that puts me in a room with other people. Not because I always feel like it, but because I understand what isolation costs. The fix is not complicated, but it requires intention. Schedule social contact the way you schedule medical appointments. Join a class, a club, a volunteer organization, something that creates recurring obligation. Obligation sounds negative, but it is actually protective. It removes the decision of whether to engage today. You simply go because you committed. If mobility limits your options, technology can help. Video calls are not equivalent to in-person contact, but they are vastly superior to nothing. Online communities organized around shared interests provide mental stimulation and connection. Use whatever tools exist to maintain contact with other minds. The second predictor is one you can test right now, in your own home. Can you get up from a chair without using your arms? This single movement, rising from a seated position using only your legs, is one of the most reliable functional assessments in geriatric medicine. It tests the strength of your quadriceps, your balance, your coordination, and your confidence in your own body. And the inability to perform it predicts nursing home placement with disturbing accuracy. The reason is mechanical. If you cannot rise from a chair independently, you cannot use a toilet independently. You cannot get out of bed independently. You cannot move through daily life without assistance. And once you require assistance for these basic functions, the cascade toward institutional care accelerates rapidly. Most seniors lose this ability gradually, compensating so smoothly they do not notice the decline. They push off the armrests. They rock forward for momentum. They choose chairs with higher seats. Each adaptation seems sensible in isolation. Together, they mask a deterioration that will eventually unmask itself, usually during an illness or injury that strips away the compensations. I practice chair rises daily. I sit in a firm dining chair, cross my arms over my chest, and stand using only my legs. 10 repetitions. It takes less than 2 minutes. If I notice increased difficulty, I add leg strengthening exercises until the ease returns. This is not vanity. This is maintenance of the fundamental movement pattern that separates independent living from dependence. If you cannot currently perform this movement, begin where you are. Use a higher chair. Allow yourself to use your arms initially, but work toward reducing that assistance over time. Your muscles will respond to progressive challenge. They are waiting for you to ask something of them. The third predictor is medication mismanagement, and it operates more silently than almost any other factor. If you take multiple medications and have difficulty keeping track of doses, timing, or refills, you are exhibiting a warning sign that healthcare systems take very seriously. This is not about intelligence, it is about the cognitive load that complex medication regimens impose on aging brains. 5 medications taken at different times with different food requirements and different refill schedules creates a management burden that many seniors eventually fail to maintain. The consequences of that failure are severe. Missed doses of blood pressure medication lead to strokes. Incorrect insulin timing leads to diabetic emergencies. Accidental double doses of blood thinners lead to hemorrhages. Each of these events can be the incident that ends independent living permanently. Hospitals track this. When a senior is admitted for a medication-related event, it triggers assessments of their ability to live safely alone. Often, the conclusion is that they cannot. I use a pill organizer with compartments for each day and time. I refill it every Sunday without exception. I keep a written list of every medication, its purpose, and its schedule, updated whenever anything changes. This list lives in my wallet, ready to show any healthcare provider. If your regimen is complex enough that a weekly pill organizer is insufficient, consider a medication management service. Pharmacies increasingly offer these. Some deliver pre-sorted doses directly to your door. The cost is trivial compared to the cost of an error. And if you find yourself repeatedly confused despite these systems, tell your doctor. This may be a sign of cognitive change that deserves evaluation. Catching it early preserves options. Ignoring it eliminates them. The fourth predictor is falls, but not in the way most people think. A single fall can certainly end independence. A hip fracture in a 75-year-old has a 1-year mortality rate approaching 30%, and many survivors never return to their previous functional level. But what predicts nursing home placement even more reliably than falling is the fear of falling. When you become afraid to move, when you stop taking walks because you might trip, stop using stairs because you might stumble, stop reaching for high shelves because you might lose balance, you enter a cycle that guarantees the outcome you fear. Reduced movement leads to reduced strength. Reduced strength leads to reduced balance. Reduced balance leads to increased fall risk. Your fear becomes a self-fulfilling prophecy, creating the very fragility you were trying to avoid. I have watched friends disappear into this cycle. They stop walking. They stop leaving home. Their world shrinks to a chair, a bed, a path between them. Within a year or two, they require the care they thought they were preventing. If you have fallen in the past year, get a formal balance assessment. Physical therapists can identify specific deficits and prescribe targeted exercises. Often, balance can be substantially improved with consistent training. Your vestibular system and proprioception respond to practice just as muscles respond to exercise. If you have not fallen but find yourself avoiding activities out of fear, that fear itself is the warning sign. Address it directly. Work with a physical therapist. Strengthen your legs and core. Practice balance exercises daily. Reclaim the movement patterns you are abandoning. The worst response to fear of falling is immobility. Immobility guarantees the outcome. Movement, even careful movement, preserves the capacity to remain independent. The fifth predictor is the one that cuts deepest, because it touches on identity itself. Have you stopped caring for your appearance? I do not mean the natural simplification that comes with age, choosing comfort over fashion, reducing elaborate grooming routines. I mean the abandonment of standards you previously held, going days without bathing, wearing the same stained clothing repeatedly, neglecting dental hygiene, allowing your living space to become disordered in ways that would have distressed you 5 years ago. This decline in self-care is one of the earliest visible signs of cognitive change, often appearing before memory problems become obvious. It reflects a loss of executive function, the mental capacity to plan, initiate, and complete multi-step tasks. Bathing is not a single action. It requires recognizing the need, gathering supplies, managing water temperature, following a sequence of steps, and drying and dressing afterward. When executive function declines, this sequence becomes overwhelming. The easier choice is to skip it. Family members notice this. They notice the unwashed hair, the body odor, the deteriorating home environment. And when they notice, they begin having conversations about whether you can continue living alone. I maintain my standards deliberately, not for vanity, for vigilance. If I notice myself skipping showers, wearing clothing I would previously have considered unacceptable, or tolerating disorder in my home that once would have bothered me, I treat it as a warning sign, requiring attention. Sometimes the cause is depression, which is treatable. Sometimes it is early cognitive change, which can be slowed with intervention. Sometimes it is physical difficulty, pain or mobility limitation making self-care genuinely hard, which can be addressed with adaptive equipment or assistance. Whatever the cause, the response is not to accept the decline. It is to identify the obstacle and address it while addressing remains possible. I want to be direct with you about why I am sharing this. It is not to frighten you. Fear paralyzes. I want you mobilized. It is because the path to a nursing home is paved with small surrenders. Each one seems reasonable in isolation. Skipping a social event because you are tired, using armrests because they are there, letting a prescription refill slide, avoiding stairs because they feel risky, wearing the same shirt 3 days in a row because who cares? Individually, these are nothing. Collectively, they are a trajectory. The seniors who maintain independence are not genetically blessed or unusually lucky. They are vigilant. They notice early warning signs in themselves. They intervene before small problems become defining crises. They refuse to accept that decline is the only available story. You have now been given the knowledge that makes vigilance possible. You know the 5 signs. You know why they matter. You know what to do about each one. The question is whether you will act or whether you will set this information aside and continue as before. If you are part of the small percentage who chooses action, who understands that dignity is not granted but maintained day by day through deliberate effort, then you belong in this community. Share this with someone who needs to hear it, not as a criticism of how they are living, but as a gift of awareness. The earlier these patterns are recognized, the more options remain available. And return here. We have more to discuss, more uncomfortable truths, more actionable solutions, more strategies for remaining the author of your own story rather than a passenger in someone else's. Until next time, stay vital.